who openly declare their intention to block reform. It's a familiar Washington script that we've seen many times before.
And we're seeing it again. The president just lashing out at his healthcare critics. Today, one of those critics responds. Welcome, everybody. I'm Neil Cavuto, and now it is getting nasty. The president accusing Republicans of trying to score political points with healthcare and pointing to this comment.
Just the other day, one Republican senator said, and I'm quoting him now, "If we're able to stop Obama on this, it will be his Waterloo. It will break him." Think about that. This is...
Well, that senator the president is referring to joins me right now, Republican Senator Jim DeMint of South Carolina, author of a new book out called Saving Freedom. Senator, you've become sort of like the man, I don't know, good or bad, of the hour. What did you think of what the president has said, that you're more interested in vilifying him than helping the health care cause?
I'm ready for the debate. Frankly, when he was in the Senate, he voted against every reform proposal that Republicans put up that would have made health insurance more affordable and more accessible. Now what he wants to do is a government takeover. And my comments get right at the heart of the matter. He's been on a rampage to take over various aspects of our economy, spend and create debt that we've never seen before, and raise taxes to just about every American. We've got to stop him. If we don't, he's going to get right on this cap and trade, energy tax, and a lot of the other agenda items that he's just been steamrolling through Congress for his first few months.
So that's what you meant by the Waterloo remark. You stand by that if you stop him on health care, you stop these other measures.
Well, the whole purpose of the Senate is to slow things down and debate them. He wants to pass things before we even read them. He did it on the stimulus plan, which has turned into a colossal failure, Neil. And now he wants to pass something that affects a fifth of our total economy in the next 2 weeks, and no one has even seen an entire bill. He doesn't even know what's in it, and he's admitted it. So this makes no sense. The bill doesn't take effect until 2013, and he's saying we have to pass it in the next 2 weeks.
But obviously you've touched some raw nerves here, including that of the Senate Majority Leader, Harry Reid, who was saying your statements were brilliant, that in general Republicans aren't interested in working with Democrats to fix the problem. That's pretty clear. Mr. Reid goes on to say they simply want to maintain the status quo and keeping the insurance industry in charge of health care delivery.
Neil, the president voted with the insurance companies when I put a bill on the floor that would have allowed Americans to buy insurance anywhere in the country. The big insurance companies are against that because they would have to compete. The fact is, Republicans have introduced many more reform proposals over the last several years than the Democrats. The Democrats have killed it because they don't want private insurance to work. They want the government to run our health care system. That's what this so-called reform is all about. The president wants to take over health care just as he's taken over General Motors and Chrysler and our banking industry and our insurance industry. And I'm serious. We've got to stop him, and that's what I said. I'm ready for the debate, but we cannot let him roll over us in the next couple of weeks.
Now, even though his popularity has ebbed a bit, I'm going to get into that a little bit more with my next guest, he's still pretty popular, and he's obviously better known nationally than you are, although you are a rising star. And do you think by him, singling your comments out, that he is using you as an example of just opposition Republicans who will stop everything he's trying to do and offer nothing in alternative?
I've offered a lot of alternatives. Just a few weeks ago, I offered a plan that says basically, if you like what you've got, keep it. If you don't get insurance at work, we're going to give you a $5,000 a year health care voucher because that is fair treatment as far as the tax code is concerned. So we've offered the proposals. I'm ready for a debate, but he doesn't want to debate it, and I think he's played right into my hands because he started talking about his health plan. Now people want to know what's in it. If they find out what's in it, Neil, they're not going to want it to pass.
All right, well, someone at the White House must be sensing the urgency of your Waterloo remarks, whether they were politically motivated or not, because every day and almost on the hour we have health care remarks coming out of the White House. Do you think this is slipping away from them, or they're just fronting this?
Well, it's really not about politics, and it's not about Obama. My problems are with really bad policy and my experience that tells me the government cannot run the most personal and private part of our lives, which is health care. Yeah, they know they're slipping. They're panicking a little bit. Anytime a president of the United States goes after a freshman senator, he's losing his grip a little bit. So I'm glad to have the debate with him, but frankly, I've been working on health care for over 10 years. I think I know a lot more about how it works than he does, so I'm ready.
All right, you might be a freshman senator, but you were, elected the same year Barack Obama was.
That's right.
You are now, by virtue of these comments and others in recent months, perhaps the most prominent Republican in the country. You going to run for president?
That's a little bit scary, isn't it? No, my first job is to make sure they don't steamroll another big bill through Congress that expands government, increases our debt. I'm going to keep my focus on the Senate for now, Neil.
For now.
That's right.
But you ruling in, out the presidency?
Oh, no, I have no plans to be president. Anyone who wants that job doesn't know how much trouble we're in as a country. I mean, it's going to take a lot of work, and I think the Republicans are starting to stand together on some principles of freedom that I think the American people are going to take to. And it's time we have a real debate about health care and other issues, because this government takeover approach is not going to work.
Senator, thank you very much. Good having you on.
Thanks, Neil.
Well, health care is still in the House. The president